There we go. So we're going to talk today about what we can all do together as community organizations and school representatives to keep it at the top of the forefront as much as we can. So today the agenda is we're going to just talk about what the task force group is all about. We've talked to some of you in our community-based organization interviews, and some of you we've talked to again to understand how COVID has impacted your work. But we want to introduce why behind it. Lee will talk about that. We're going to talk about what we've learned since October of last year, just to catch you up. And then the amazing Laura Morehouse is going to talk to us about COVID and vaping. And then we have some great tidbits we learned from all of you in our initial and re-engagement interviews. And then we want some time to do some small breakout groups where you can meet others that are in this space and learn from them as well. So I'm going to kick it off, and I should also mention my name. I am Heather Hiscox. I'm the CEO and founder of Pause for Change, and I've been supporting the work with the task force group since it first started and working with the amazing Lee and her team. And these are the members of the task force group. I know it's a bit hard to read. We have representation from districts all across the Pima County. And we've had some people on this list that we have had retire, so we lost some of our friends that won't be continuing, but hopefully we'll get some new representation from those districts. But really wonderful group of folks that have come together every month and then done homework every month and been very communicative and very supportive of this work. So right now we're a bit on pause, as you can imagine, with the schools and districts, but keeping the momentum going, especially engaging with community members and organizations like yours. So Lee, why don't you take it away and share what's been happening with the task force group?
All right, can everybody hear me okay?
Yeah.
Good, excellent. So don't be surprised, I'm probably reading off of some notes here because, as you can imagine, the majority of our team has been assigned to our emergency operating center, so it's been very chaotic. But I just want to say, first of all, that I'm very thankful that you're all attending this virtual community partner event. Me personally, I am not a virtual person, but I'm quickly learning to be a virtual person. We really intended to have this event back in March, so I'm so incredibly happy that it's finally come to fruition today. And so for the purposes of this presentation, I think it would be helpful to provide some background regarding kind of our Real Deal on Vaping campaign and really the task force group. And so the Public Schools Task Force Group was conceptualized and implemented as a component of our Real Deal on Vaping youth prevention media campaign in Pima County. And a part of what we do for tobacco control for all of Pima, there's several different components that we focus on. Outreach and education is one of them, policy initiatives, cessation, resources for young people now, and adults, and media campaign is a significant component as well for us. Without any of those, we're just not as efficient as we could be in really keeping messaging and engagement and resources out to meet folks where they're at. And so one of our media campaigns has been the Real Deal on Vaping campaign. We were able to collaborate and partner with Superintendent Williams and with his fantastic team there at his office. We were able to establish and convene members from each school district for the group, with the idea that with facilitation and with feedback, that task force group members would be able to identify priority areas and strategies to address youth vaping. Significant to me in having that environment because it really it avoids the health department going in and sharing and telling folks that you should do this or you need to do this to be able to address challenges that we have in our community. Instead, this is an environment where we can bring everybody together to share and learn from one another and really think through what those priorities are so that we can put that into a plan that's meaningful for everyone. It's also kind of a challenge when many different groups, schools, health department, public safety, just faith-based as an example, speak a very different language. So when we can come together and talk things through and have our, put it into something that's meaningful and a plan, that's really what the purpose, one of the goals of this task force group was, to really be able to address youth vaping very comprehensively in Pima County. So again, the priorities and strategies then we would outline into a comprehensive action plan for that group, so that the group could take that plan back to their districts and implement the plan with local resources and community support. Where are we now? So I kind of briefly mentioned that our whole tobacco team, there's really only been a couple of us, but our whole tobacco and chronic disease prevention team since March has been assigned to emergency operating as a part of the COVID response. And so it's been a challenge. I know everyone's been through challenging times, which makes it kind of difficult to focus on programmatic, on program strategies and that sort of thing. But that's just kind of where we're at. Been very fortunate to continue our partnership with Pause for Change with Heather and Amelia before she left, to continue to do this work in a meaningful way, to find where is the space that we're all at right now. Schools were out early, teachers and students were out. We had our youth coalition still trying to communicate, but it was all so very quick and fast. And there were many different changes with the community partners that we all work with. And so I felt like, as a part of us moving forward since March, what we could do to continue this effort with the Real Deal on Vaping and with our task force group was, we could continue to support one another, but we could also continue that engagement, but we could reach out to our community partners and really hear it from all of you. Where are you at? How has your organization changed? How are you reaching folks? What does that platform look like? Is it meaningful? What is the feedback that you're getting from folks that you're working with? Are you still operating? Because I'm sure that it may be very sad to hear that maybe some of our partners just aren't in a position to continue operations. So I think being able to have had the opportunity to conduct this environmental scan that you'll hear about today has been significant. Transition, what that looks like, we'll be tasked with thinking through how to meaningful meet youth and adults where they're at, in particular with a focus on strategies to focus on modifying health behaviors for folks. That includes tobacco use, but physical activity, nutrition, and also stress reduction. I think I'm running out of time. I didn't time myself, Heather, but I have a suspicion. Thought it was worth noting though, and I'm just going to shift to some recent activity that came out nationally. FDA recently issued a cease and desist, I believe, for 13 companies, including Puff Bar, which was one of the up and coming e-cigarette brands, to discontinue selling their fruit flavored e-cigarettes. Yay! So that's a win, and we're moving in the right direction, which is great. Next slide, for COVID messaging, wanted to be able to show you some other messaging that's been out there from WHO and also from some of our national partners, because we know that the tobacco industry for years has used insidious marketing tactics to target and hook youth on tobacco. So it's refreshing to know that WHO and other national partners have been diligent in incorporating tobacco prevention messaging as a part of the COVID-19 response. So there's some messaging there from WHO. We have some from the Campaign for Tobacco-Free Kids. And then we have information, next slide, from the CDC. And then we also had some slides there from PTAF. Wow, I look really tired. From PTAF, otherwise known as our Tobacco 21 friends across the nation. And I think that's it for me. And I'm really excited to be able to have Heather provide some background information now for you.
Yes, thank you so much. This is great. So we have been working, as I said, since October to really learn as much as possible to understand what is happening within the community and how we need to meet everyone where they are. So the why and some of the early learning that we had is that each district and sometimes school differed in knowledge and strategies, and I'll go into each of these, policies and enforcement, and data collection. So we really wanted to start working towards getting everyone on the same page and adopting a lot of similarities in these areas. So with knowledge from our task force group members, there was a lot of variability in experience that people had with vaping, from seeing very little to seeing a ton. It was pretty common to hear that students were schooling staff, right? They were really the experts in teaching what's going on. These are some of the questions that you're at the bottom there is, what's in it? What are the symptoms? We found that training opportunities were more few and varied at the district and schools, and there was a lot of different sources of information being used, so that also wasn't shared as a collective. So they have been trying to use resources from all of these folks on the list, so CDC, Department of Education, referrals to community-based organizations like yours, presentations being offered, curriculum and health class, some had canned programs, handouts, posters. There's a lot of different methods, and again, we wanted to have a more united force. Around the policy within schools and districts, we asked each district representative to show us what the policy was on vaping within their district and schools, and all of them were different. They all prohibited use, of course, on campus and had zero tolerance, but some of their policies have been recently changed with increased use at this school and increased demand. Some schools had to change the policy because parents were sending their students with like CBD oil to school, and the nursing staff had to figure out what to do with that. But lots of different sources and inspirations, and we needed to know, where are those policies? So a lot of interesting learning in those conversations. After the policy phase, right, what's the enforcement within each district, and what are schools doing? Again, a lot of variety and different sets of consequences based on suspension, call law enforcement right away, versus more diversion tactics and a lot of different options. Definitely each had an escalation of offenses. The consequences got more steep based on and what they had already done in school. A lot of concern about THC and other substances being inside the paraphernalia, inside the devices, but schools readily admitted that they don't know what's in them unless the student says, or they can open the device and actually see what it is. So oftentimes they had to treat every device as if it had nicotine, where some of them could have more illegal and illicit substances. So that made it difficult for them to assess some of those consequences. The next area that we dove into was around data. How do we know if what we're doing is even making a difference? How do we know what's happening in increase in vaping? What is there a decrease? How do we collect and share this data? And a lot of schools and districts were relying on kind of a feeling of, I think it's getting better, or I feel like it's getting worse. And we thought, okay, we need to track some numbers and attach numbers to that. So some of the findings we had is that the districts varied in the software and database they used for tracking, how they tracked cases. A lot of districts don't regularly collect this data from their schools, so it was a lot of variability, and there was no appropriate disposal. And that's a project that Lee started talking to the EPA about, was that schools are oftentimes just filling drawers full of devices and then throwing them into the trash. But these contain toxic substances that really should not be in our landfills. And so what do we do about that? And we started working on that as well. And with the data sharing and data collection, we created a standard form that we started giving to each district to collect the data. And there were some challenges, and then COVID hit, so we haven't had a chance to really dive back in, but we're trying to set up some standardization in how we collect this information so we can look at impact. We also talked to the accommodation school district, which is a district under Superintendent Williams' purview. And that was so helpful because it really opened our eyes into juvenile justice implications. It opened us up to understanding really amazing programs like justice boards and teen court, and how students could have different variety of options. These are some of the pieces that we walked away with, was that there are a lot of resource constraints in that district, really different than what we're seeing in other districts, what the referral processes are like. And what we heard from talking to some of you and to our task force group members is that having kids out of school on suspension is a little tricky, because what is happening with those students? And there were a lot of questions about what other diversion programs there could be. So those conversations are still ongoing with our policy talks. The next group that we interviewed were young people. And we talked to 147 youth. We did surveys and we did some interviews. So you can see on that first bar graph, we had mostly 7th graders followed by 11th and 12th graders. And you can see on the bottom chart, we really had to lean on our charter school friends and networks, because getting into the public schools to collect data, as many of you I'm sure have experienced as community-based organizations, is really tricky and difficult. So the charter schools were really helpful in helping us access students. And these are just some basic takeaways. About less than half had tried vaping before. Some of those had quit and some of them were still using. More than half had been offered a device. Many did start in middle school, is what they reported, some as early as age 8, which was very disturbing to say the least. Youth told us that adults don't know what to look for, and some youth reported that even when adults do see them vaping, they're not taking action, which is good feedback for us to provide to the school district representatives. Many get it from a friend, and they're seeing a lot of this in the community, family members using, and a lot on social media. They think very negatively about cigarettes. That was very clear. They understand the health effects. Many could also share the general health effects of vaping. And what was interesting is 94% of the young people said that a health professional, a pediatrician, a dentist, others that they work with in healthcare had never talked to them about vaping, had never brought it up in a medical visit, which was interesting. Many did not know the larger penalties for vaping in Pima County and the city of Tucson, but they knew what would happen at school. So they weren't aware of some of the justice issues where they might have stronger penalties. And some of them said, you know, some kids are gonna vape no matter what you say to them. So that was interesting. But what they thought that other youth should hear about are those top bullets. They thought that youth should hear about the effects on the body, the legal consequences, because they didn't know that, so they thought other kids should know, the cost and money invested in vaping, and then how to quit. And we heard from many of you, like, we should talk about it as if it is an addiction and give students resources to quit. They wanted to hear from peers or someone that's just a few years older. They want to hear stories about someone like them and how they overcame vaping addiction. And they want hands-on, you know, active and talking through it. And many were already doing research online. What was interesting is we talked to parents. We only got to talk to 12 parents before COVID hit, but we were doing interviews and surveys. And what was interesting is that 79% of youth, when we asked them in their survey if their parents had talked to them about vaping, they said they had not. But when we talked to that small group of parents, 83% of them said they had talked about it. So the sample sizes are mismatched, but that was sort of interesting. And 2 of the parents out of that 12 did vape themselves. Parents said, which was also interesting, that they wanted to hear about this at parent-teacher conferences, school events, and like school nights. But what we heard from our task force group members is it was so hard to get parents to show up for these events. So we were really eager to keep digging into this information. Too bad with COVID, we had to put that on pause, but you can see there's some richness that we need to really get into. Parents said they want to hear more about the health information, current statistics about who's vaping, what's being done on campus. They want to know what schools are doing to curb vaping and prevention. And then, of course, they couldn't help themselves. They want to know how their kids are doing in school and their classes, which was very sweet. So we started forming action plan priorities, and we started forming a draft action plan of what schools could focus on. They would all be united. And so around students, we were just digging into what peer-to-peer opportunities for learning would look like. We were diving into best practice resources. For parents, again, with that disconnect, we wanted to learn more from parents to know how to serve them better. And then again, reinforce the Real Deal on vaping momentum and have more consistent media messaging and some additional partnerships. And then with all of you, we interviewed so many of you for this project, And we wanted to figure out how, again, we could have a cohesive message across the county within schools and community-based organizations to share resources. So we're hoping to dive back into that. And now I am going to turn it over to Laura Morehouse from Arizona Poison and Drug Information Center. And just when Laura and I were talking through her topic, oh my gosh, it's such great information that I know will be so helpful. So Laura, why don't you go ahead? I'm going to stop sharing. You share your screen and we'll see all the great stuff you have to share with us.
All right, thank you so much for having me. Let me get this ready to go. Okay,
Perfect.
there we go. All right, welcome everyone. My name is Laura Morehouse and I am the Community Outreach Coordinator for the Arizona Poison and Drug Information Center. I know I've worked with many of you in the past, but if I haven't, I'm very excited to be able to talk about vaping and COVID and then have potential partnerships arise from this in the future. So I'm going to be doing a little overview on what we're seeing with vaping and the pandemic, as well as some of the preliminary research that has been done on how vaping and smoking potentially exacerbate or make people more susceptible to COVID-19. If you have any questions, feel free to throw them into the chat. I think we'll answer them at the end. And if I'm talking too fast, just tell me to slow down. Okay, so I'm just going to introduce the topic by talking about the changing landscape, both in general and with the pandemic. A little bit about EVALI and the resurgence we're seeing in a couple states across the United States. Vaping and risk, vaping and severity related to COVID-19, and a little bit about what we're seeing for what's next, what's going to be the new hot topic now that JUUL devices and other disposable products have the flavor bans associated with them. So just a little introduction, truth behind the haze. As many of you know, e-cigarettes are a very popular recreational tool, both youth, both adults, but there are very few comprehensive studies that go into the long-term health effects, and that is still very true today. So what are we seeing? A big increase in students using e-cigarettes in the past 30 days. This was the CDC National Youth Tobacco Survey back in 2019, but almost 30% of high school students were using an e-cigarette in the past 30 days, and that's a pretty large jump from previous years. We know that there is an effect with flavor. So we see fruit, menthol, mint flavors, very popular. 60% of teens who vape use fruity flavors. There's lots of really crazy ones out there, especially ones that are candy-like. What's one thing that's interesting is perceived addiction, is that current e-cig users who use flavors perceive themselves as having more of an addiction to vaping than those who did not use those flavors. And as Lee mentioned, there is the flavored e-cig ban where the FDA is looking to close the loopholes created by those disposable products. So hopefully we're going to see some effects from that soon. Interesting enough, flavor really isn't the biggest driver of vaping use anymore. A recent study from this year actually found that the social influence was a way bigger indicator of use than flavor. So 60% of youth that were surveyed in this study said it's social reasons because it's trendy and cool, it's a social experience, peer pressure. Only 5% actually mentioned flavor. So we might be seeing the effects of the flavor bans now where it's more social influence than flavor based. But hopefully we get more research coming soon that continues to expand on this topic. Now we're seeing with COVID-19 that there has been a lot of social disruption. As you know, everything's canceled. So we're seeing that there could be an increase for e-cig utilization because of the loss of school, especially right now. Schools attempting to go back into in-person, but there's a lot of variables with online, hybrid class styles, but it's a loss of the normal. A loss of work social structure, especially for high school students that might actually work right now. Home confinement and stress related to having to interact with parents or siblings at all times. So all of these factors could potentially increase our utilization of e-cigarettes, although there is not that much data right now. These are ideas. What are we seeing? There was one study I was able to find this year that studied use patterns during the lockdown, and this was across 5 different countries. And they found that e-cig consumption increased slightly, but the type of product and the amount they were using basically remained unchanged, which was surprising to me. I figured they would all increase. And of course, nicotine users were reporting that they were using it for stress and anxiety coping. So they're stressed about becoming ill with the virus, about losing their job, about dealing with stress, about staying at home. So all of these factors went into their use patterns. Unfortunately, there's not too much other data that I was able to find recently, but just from this one study, we can see it might be a problem with the quarantine. And then marijuana and vaping, this is becoming much more popular, and as Arizona moves to have recreational marijuana on the ballot, this is only going to become much more of a problem. We saw in 2019, 14% of seniors reported vaping marijuana, which is about a 7% increase from the previous year. It was the largest increase across all of the age groups. The problems are that when you vape marijuana, it's a much higher concentration of THC compared to something like a bong or a joint. And we're seeing that regular marijuana use, of course, disrupts the brain development, could lead to problems with attention span, behavior, and impulse control as the brain is still developing. And unfortunately, a lot of the teenagers that we see and we talk to don't seem to understand that marijuana can have potential side effects. It's weed. That's what we hear. And when I talk to students, that's what they say. There's nothing wrong with it. Unfortunately, THC, especially black market cartridges, have been associated with EVALI, which is our e-cigarette and vaping associated product use with lung injury. And this actually just happened. So California saw 8 new cases in April of this year. 6 of those patients reported vaping THC, and the median age was 17. Minnesota, just this month and in June, saw 11 new cases of severe lung injury, and all of these cases in both states were hospitalized for this. Most of those patients reported vaping THC, and the median age there was 18. So we are seeing a resurgence. We haven't had any cases yet in Arizona that we know of, but it's coming back, and this is especially concerning during COVID because we know how much damage to the lungs EVALI causes. So we're very worried right now about the resurgence that we're seeing. Most of that's caused by vitamin E acetate. It's been strongly linked to the EVALI outbreak by the CDC and the FDA. If you don't already know, vitamin E acetate, it's an additive. It's used as a thickening agent in most of these vaping products. And these were mostly black market. So they're from informal sources like family, friends, or online dealers or in-person dealers. And even with these new resurgences of EVALI, they're still finding vitamin E acetate in those products. So it is still happening. It didn't go away last year, especially with the pandemic, it's still there. And we're seeing a lot of the industries seizing the opportunity to advertise during the pandemic. I'll show some images in a second that are very recent. So as Heather and Lee were saying, this is what's going to be happening and still happening with the pandemic. So they're offering freebie masks, they're offering freebie hand sanitizers with purchases, they're offering doorstep deliveries so you don't have to go in person. They're doing festive pandemic themed discounts where if you purchase something, you get 19% off because COVID-19. So very trendy and very persuasive. So I'm going to show some of those right now. So this one was celebrating International Nurses Day. This is Modi America. So, you know, interesting. This one is a BD stick a day keeps the pulmonologist away, which doesn't seem like it makes sense. But they are saying they're cooler, which means your airways and throat are safe. This one is saying that if you are quarantined at home, you can get a mask by purchasing one of their products. So each, you get a mask for free if you buy this vaping product. And then the same thing, you get a mask, a coupon, and a new vape device during the pandemic. So very persuasive, very prevalent. If you go on Instagram and you search the hashtags, this marketing and advertising is there. So then the question becomes, does vaping increase the risk of contracting COVID-19? And unfortunately, there is some controversy in this area and there's not much data. So the health concerns that we've seen over Twitter, social media, people are asking, if I vape, am I at higher risk of infection? Does vaping make individuals more susceptible? Because a lot of the research right now is in smokers. And then is there elevated risk of COVID-19 because of I'm sharing my vaping devices, or maybe passive exposure from the exhale of those vapor clouds? And that third point they are seeing is plausible at the moment, that sharing vape devices and passive exposure because of secondhand exposure could increase the risk of COVID-19. We're also seeing a lot of unsubstantiated health claims all over Twitter and the internet. You might have even heard some of these yourselves. We've seen that increases the humidity in the lungs, so it prevents infection that way. We're seeing that, wow, propylene glycol can destroy the harmful airborne contagions. And my favorite, that vaping offers a way to administer medication to the lungs. One of the tweets that we saw was that devices could act as a delivery vehicle for oregano oil, which has been alleged to destroy the virus. So there is a lot of misinformation out on Instagram, on Twitter, on TikTok. There's good information as well, but we're seeing a lot of this during the pandemic. It makes it only more confusing. So what do we know? Not much. Pretty much the only thing that's come out is this FDA statement, which was revising a previous statement that says that e-cigarette use can expose the lungs to toxic chemicals, but whether those exposures increase the risk of COVID-19 is not known. And this is the current policy of the FDA. So it might, but we don't know. This came after the FDA released a statement associating vaping with susceptibility to the virus. There was severe backlash by pro-vaping companies and industry. And so this is the revised statement that came out in April. And that's pretty much where we're at with susceptibility. Luckily, there's a lot more data on COVID-19 severity. So does vaping increase the risk of developing serious symptoms instead of just contracting the disease? And there's a lot more research, although again, this is mostly preclinical. So there are a lot of issues with the research data, very small sample sizes, making a lot of assumptions, but here's what we know. I've included basically 6 studies that go over different aspects. The first couple are on smokers because there is more research on smokers than vapors. The first one, finding that smoking depresses pulmonary immune function. It actually had almost a doubling of the risk of progression of COVID-19 in the hospital. Second one found that current smokers admitted to the hospital were almost 2 times more likely to die than non-smokers. And the third one, a Chinese study found that for hospitalizations due to COVID-19 induced pneumonia, patients with a history of smoking were 14 times more likely to be at risk for progression of that pneumonia. And then the fourth and the fifth get more into the vaping side. So they looked at both smokers and vapors, and they found that tobacco and e-cigarette smoking have a detrimental effect on the blood-brain barrier. This study in particular was looking at effects to the central nervous system and how COVID-19 might increase the risk for strokes and blood clots. So that's what that study was looking at. And they said it could be speculated that smoking could lead to an increased severity of COVID-19 by affecting the blood-brain barrier, which helps with infection control. And then our fifth one down there, just showing that e-cigarette aerosols can damage lung tissues, can cause lung inflammation, diminishes the lung's ability to respond to infection because it weakens the protective cells. So all of this culminating in the idea that harmful effects of smoking cigarettes are more substantial than that of vaping, but given the similar effects between smoking and vaping on the body, they caution against the widely held opinion that e-cigarettes are safe. So that is kind of where we're at right now. Again, about 6 research studies that came out in their last year or this year. There's not a lot out there right now, but we can make the assumption that yes, vaping probably is going to make COVID-19 infections worse or more serious. And then this was a statement by the Chief Medical Officer of the American Lung Association and one of the policy statements that they released, where he said it'd be reasonable to think that any condition that affects the lungs, regardless of the ingredients inhaled, could play a role in making someone more susceptible to complications from the disease. So we can't say anything for sure. There's just not enough long-term research out there. The pandemic only started back in February or March, but this is where we're at right now. So what's next? More research. That's always the answer for vaping. We still don't know even just the general long-term effects of vaping, and that's only going to become complicated by COVID-19. We do expect that people that had lung injury from the Valley surge last year, probably more at risk. It's potentially makes you more susceptible to the disease, and there is light correlation between vaping and smoking and then progression of the disease. But we're not going to know more for a while. Things that are coming up and becoming popular. The first one is dab and wax pens. If you've seen them at your schools, I actually did a presentation to a middle school, and the kids had no interest in the nicotine part. They just wanted to know about wax pens. They wanted to know if they were safe. They had tons of questions about marijuana use. So I'm seeing a lot more of the trend towards marijuana and knowing more about wax pens. What are wax pens? They concentrate THC, and people can smoke them in a variety of different forms, which I'll show on the next slide. People have called them an on-the-go high. They're not new, they've been around for ages, but it seems like they're gaining popularity among the middle school and high school population. They have no smell, they only require battery power, and they're reusable. And then next to that is snus. Those are new oral tobacco products. They're oral pouches, and I'll show what those look like as well. Those also have been around for a long time, but there is a resurgence coming around with COVID-19 and people worried about inhaling the products. So these are the dab pens or wax pens. What happens is a concentrate is placed in the heating chamber rather than loading a vape cartridge into a liquid form. So users can use concentrate, they can use wax, batter, butter, shatter, anything like that they can throw in there. So there's a lot more options. And then the next slide, these are some of the oral pouches. So what they are, it's nicotine, so they're tobacco free, but it's nicotine in a little pouch that they stick up into their gum and then they just suck on it to get the nicotine. The one in the middle, the On, those are the American brand, and they are flavored. So there's cinnamon, citrus, cool mint, and black cherry on here. So we're starting to see that this might be a more viable option for people. And unfortunately, it will likely get into the youth population as well. Now, that's a lot of information, so if you do have questions, I'll do my best to answer, but the basic concept that vaping likely does increase susceptibility and disease risk for COVID-19, but there's just not enough information out there at the moment to really make firm claims. And I'll show this slide. This will be sent out to everyone. But if you want to read the actual studies, I have them all listed here so you can go and find them. They should all be free online. There's a lot of good information out there. But for now, I will switch over and see if there are questions. 1 second.
Thank you so much, Laura. That's amazing. We want to open it up to the chat and to any of you that have questions. Laura's an amazing resource. So Monica has the first question. Are there any resources in Pima County to refer youth who may be experiencing substance use disorders?
That is a great question. And I typically don't work with referring youth to experience substance use disorders. So if anyone else is on the line and would love to answer that question who works with substance use disorders, please answer that in the chat. That's not my specialty, but I know there are plenty of resources in Pima County.
Yeah, the comment is that a lot of places offer counseling, take care of adults. Who wants to chime in? Did I hear from someone?
Mm-hmm. Sin puertas.
Okay. Lisa, do you want to unmute and tell us a little bit more?
Hi, Heather. Thank you. Can you hear me okay?
Yeah, I can hear you great.
Hi, yes. Sin Puertas is part of Pima Prevention Partnership, and we are an adolescent substance use specialty provider. And we see 13 to 20-year-olds, and we get referrals from any provider or juvenile court can refer, and we provide SUD co-occurring with a trauma-informed approach services for adolescents here in Tucson.
That's great. And Jamal from LPKNC, you're talking about Kodak. Can you say a little bit more? Can you unmute yourself?
Yes. So
There you are. Oh, you're muted. We can see you now, but you're muted again.
There we go.
There you go.
Yeah, Kodak has a product also for adolescents, and you can give them a call and they'll get you in as soon as they can.
Awesome, awesome. And then COPE has offers as well. So Nancy, do you want to talk about what COPE can offer?
Hi.
Hi.
So Cope Thrive, we also offer substance abuse education. We have our IOP program in person through Zoom. We also offer MAT services, medication assisted treatment for those that qualify. So any questions, I'm available.
That's great. That's great. And then Julie Max says Arizona Complete Health website has a lot of resources. You go to azcompletehealth.com. And what I'll be doing is I will have all of the chat content, and we're going to add all of that to a follow-up email with Laura's slides, a place where you can go for all these different resources. So we'll make sure that's all in the email as well. So Adriana Martinez, Arizona Youth Partnership in Ajo, do you want to talk a little bit about that?
Hi. Well, we also offer education, curriculum-based education for students. We work really close with the school and with other community partners here in Ajo to educate our youth. And we try also to engage them in different activities around the community. So that way kids have a more like a creating protective factors for them.
That's great. And then Debbie from Aurora Behavioral, Tempe and Glendale. Are there offerings in Pima County? I'm wondering, Debbie?
No, we don't have anything done in Pima County, but a lot of our patients come up to Phoenix. So just kind of depending on, the situation and what they're looking for. And then we also do some different trainings for free. We do a vaping presentation, and we also do a More Than Sad, which is a suicide awareness that counts for the school coverage. So those two we can do virtually also.
Got it. Okay. So thank you everyone that chimed in for that. Any other questions any of you have? Another question. Okay, Monica, what are the current legal implications behind THC wax pens and teen use?
Yeah, currently they are considered illegal, like all other marijuana products that are not medicinal in Arizona. Yeah, they're illegal for teen use at the moment. If anyone else is in the legal arena in this, I think there are some people, if they want to chime in there.
We have folks from Pima County Attorney's Office. If you want to let us know, or even from Teen Court. I know that Kate is here from Teen Court. I'll call you out, Kate. Anyone want to chime in about this question?
Hi guys, my name is Jordy. I'm with the Pima County Attorney's Office Community Justice Board Program. The legal ramifications that we are seeing right now are youth that are caught on school grounds. They're receiving felony charges for marijuana possession, paraphernalia. So we see them through our program, and we take them through a restorative justice kind of approach to repair the harm that was caused by the offense. We're really here to kind of find out how vaping is interacting with COVID, but also to gain some really good resources. So I'm so happy that Cienfuegos and Kodak and COPE are all here.
Absolutely. Any follow-up questions for Jordy? Or
Just
that question, chime in.
If I just can add just a little bit to what Jordy says. Hi, Jordy.
Yeah,
I believe they only need 1 drop of THC oil to have the felony charge. So they only need 1 drop. Just to add a little bit about the felony part of THC.
Hi, this is Kara Crosby. I'm with the County Attorney's Office too. I'm a prosecutor. And we do have those charges come through, and it's actually not it's cannabis is what it's considered. It's not marijuana because of the nature of the substance, which is actually a class 4 felony for a narcotic drug. So we tend to not charge that, or we charge an alternative charge for drug paraphernalia for the devices they're in. but it can be, and it often is, depending how many cartridges they have, depending how many referrals they've had to the juvenile court, it can be charged as the class 4 felony. So that does happen, at least here in Pima County.
Thank you.
There's also requirements, age requirements for who you can sell it to, correct? Can you talk a little bit about that?
Yeah, I can touch on that a little. I think they just changed it, or maybe they didn't, but at least for the vaping devices, it's under 21. You're not allowed to sell. For marijuana, I'm not familiar yet with the update on that side, but most people, most teens and youth are getting them informally. So they're just grabbing it from a friend who might be old enough to purchase. They're getting it from a family member who perhaps just leaves it out in plain sight or gives it to them. So most of the teenagers that we see are getting it from a friend or family member or from an online dealer, in which case it's kind of underneath the table. But if anyone else would like to talk, I think I'd have to go back and look at the medicinal marijuana laws for Arizona, but I think it's 21, 18 or 21.
I can talk to that a
Yeah.
little bit. This is Jamal Givens with LPKNC. So as far as marijuana is concerned, one of the challenges that's happening with it as far as youth use is that youth can get a medical marijuana card per permission of their parents under the age of 18. So you can have a youth who's 12, 13, 14, 15, 16, 17, all the way up to 18, and get a medical marijuana card. So what they then do are able to then purchase medical marijuana from dispensaries, and then they're sharing that, of course, with friends within the community. And so it's one of the challenges that's out there when we're talking about marijuana. As far as, purchasing wax concentrates outside of having a medical marijuana card is definitely, illegal, period, no matter what age. So the medical marijuana piece is the challenge for us. And if you're 18, you can go in, get a medical marijuana card on your own, and just, say, I have chronic pain. And they're like, all right, cool. You got a card.
So I'm a little confused because we just fought so hard to make sure that people couldn't purchase the vaping products until 21 now, yet for the medical municipal, that's still 18, Jamal?
Yes.
Wow.
Unfortunately, my nephew just got a card, which I was not happy about, and almost, never mind. We got prosecutors on the line. But yeah, no, that is true. Yep, we got a problem.
That is a problem because that kind of contradicts our mission of what we were trying to do, which we knew that teenagers that are 18 are still hanging around youth under 18 versus when they turn 21. For the most part, you have your exceptions, but for the most part, we know that when they're 21 and older, they kind of start venturing away from that high school scene and go more into the college kind of, I guess we'll call it the party scene or kind of the older crowd. And so that's a little disheartening to say, at least. Wow, I did not know that.
And Royce is saying they can buy the products online as well, which we did hear people talking about. Absolutely. Any other questions? We can take like one more question and we'll move on to some other updates. Monica says, are there initiatives in Pima County working now to get smoke shops or dispensaries involved in preventing underage use? Lee, do you want to speak to that one? What's happening with dispensaries right now with COVID?
Yes and no. So with dispensaries, and let me back up a little bit. There's kind of a fine line when it comes to our program here at the health department with tobacco and chronic disease prevention because of how we're funded via tax dollars. We are really only permitted to focus specifically on tobacco use, prevention, and all those different components that I talked about, which leaves a huge sort of challenge, and Jamal just brought one up, because there is such a huge need on focusing on prevention of other substance misuse with paraphernalia in general, right? So we know that young people, and I'm coming back around to answer the question, but we know young people can use paraphernalia to not only for marijuana, other substance, but for alcohol, for meth, for other substance misuse in general. So we have a long way to go, but unfortunately our program here at the health department really is obligated to focus specifically on tobacco shops, vape shops, that kind of thing. I think that there's a definitely a fine line when it comes to, I feel like a squirrel right now. I'm so distracted virtually. There's a fine line when it comes to thinking through how to partner with organizations that sell these substances. I think that it definitely takes the community to be in a better place for young people and for adults and for families. It takes all of us working together. I'm not really sure what that would look like, even if we were able to really kind of work with dispensaries and that sort of thing. But there's definitely a huge opportunity to have those discussions, and I believe a definite significant need in the future, especially as this state thinks about what legalizing marijuana might look like. And that not only from a youth perspective, but from a secondhand smoke perspective, which we don't think about as well, which is significant. Secondhand smoke and the effects and the detriments associated with that too. So I hope that that kind of answered your question in a roundabout way.
Mm-hmm. And what about the Attorney General's office is really pausing the inspections right now with COVID? That's something that we've heard, is that they are not really doing the full like sting operations and all of that with COVID.
So FDA, the FDA, and that's not something we really like to put out there.
Don't tell anyone.
we don't want to tell. We don't want to share that. But there has been challenges nationally. There's been challenges across the state, and there's challenges right here in Pima County, and with what it looks like to provide guidance and inspections in a safe and effective manner. So that's been a challenge. And there's so much unknown right now. We don't know, we don't know what's going to happen with this virus. And so we're just in this huge gray area. And that's why I'm so incredibly happy that we're all together here talking about all these very important things.
Absolutely.
Can I jump in real quick? I wanted to piggyback real quick on what Ms. Lee said. That's really, really crucial. And I'm glad you brought it up, Lee, which is the paraphernalia, the pens themselves and devices. Ms. Laura, you mentioned it and brought it up in your presentation. It's so true that we just don't know what's actually in those devices. And because the juice itself looks like it could be nicotine, it could be marijuana concentrate, it could be meth, it could be heroin, it could be, and so you never really know what those young people are hitting when they're on those devices. So Lee, I appreciate you bringing that up. That is so important. So maybe to Mr. Dustin's point is, really looking at the paraphernalia pens themselves and trying to reduce that as far the age limit might be a route to go. So thank you for letting me jump in.
And I'd like to just add in really quick that the Poison Center is doing research currently on non-cannabis additives in street products. So we have seen evidence of pesticides, cutting agents, vitamin E, and other products that are being introduced into street products as well. So there is a lot of contamination happening.
Thank you. Well, we're going to keep moving, and I want you to have some time to connect with each other. We're going to have small breakout groups, but we just wanted to let you know some of the things that we learned from you. Can you see my screen okay? Thank you. So we did initial interviews, and then we re-interviewed many of you. And these are the pieces that we learned, is that, you know, most of you are nonprofit organizations or part of agencies. There might be grant or government funding. One thing we heard from many of you is like, we can have these events, but we have no money for food. We can bring people in, but we don't have any budget to feed these families and kids when we bring them in. So that's very interesting. This is all information that we share with our task force group members, trying to emphasize to schools and the district reps that they should partner with community, that we have amazing people with extensive expertise. You all have great trusting relationships that you've built with community. You have your own networks. A lot of you are leveraging social media in really wonderful ways. You're mobilizing energy and engagement around these topics. Some of you admittedly had different levels of knowledge about vaping and all the different issues involved with it. And you did ask for training and resources, where hopefully this partially satisfies some of those questions. Only a few of you had heard of Real Deal on vaping, which we thought was very interesting to test, you know, community expansion of those efforts, and that you're used to collaboration, you're used to partnerships, and this is how we get work done here in Pima County. So that was great. Some of you have expertise and methodologies and theoretical perspectives that you use to talk about the why behind youth behavior in vaping, which was excellent. You have some ideas about what works and what doesn't. You have access to best practice information. You are also, as we are, seeing an increase in vaping, and you want some more focus, especially on THC. But just as Lee referenced, many of you are also funded for nicotine specifically, and this makes it challenging to really cross into multiple areas. And many of you said, which is very kind, that the health department has been a great partner already, and that the health department is really steps ahead in trying to get ahead of these public health challenges pre-COVID. We shared with the school some of the challenges that you all have in working with them. We talked about the scheduling constraints being so difficult, that trying to get buy-in from administrators and parents around some of the messaging that youth might receive was a challenge, and you really rely on champions to help you do your work. We shared some of your best practices of what has helped you get into schools, where you've been attending events, you've been present and really right there to offer resources, even if it was outside of what you do, providing referrals to other organizations, just being amazing partners, and being really flexible with those scheduling challenges and identifying who can support within parents and administration. What has helped many of you, as you said, conducting outreach through multiple channels, sending a lot of reminders before your events, providing incentives and food, even though you don't have budget for it. And many of you provide local data so that it can seem a bit more relevant to youth. So we hope that we were able to share your message with these school representatives to say, hey, we have amazing folks that want to help you, that want to partner with schools. Just reach out, and they're here. And so to that end, we created a very lengthy resource list for each of our task force group members, where we put all of your names, your organizations, what you do, where you are located, so they could use you all as resources to reach out. So this happened right before COVID, so hopefully after they'll come back. So what we heard when we re-interviewed many of you is that you are pivoting the very best you can. We were so impressed by so many of you that have gone to virtual formats to still work with youth and families, but that you're having a hard time reaching them. I've re-interviewed a portion of our task force group members, and we're hearing the same thing, that during the summer, schools don't necessarily talk to families and kids that often, but it has been a struggle, especially as schools starting to come back. Many of you believe that kids are struggling and you just can't get to them, and you are really worried about them, especially their mental health and other issues with vaping. As Laura said, and we reinforce, we don't have good data right now to know what's happening with use. Lee and I have a call this week with the Arizona Department of Revenue. We have a contact there with the director's office, and we're trying to see if we can even get sales data as a proxy for what's happening. So hopefully, cross fingers, we'll be able to get something there. But we just don't have a lot of information. And I've heard everything from it must be increasing to it must be decreasing. So we'll have to see what it keeps emerging. And many of you are asking, when do we get to go back into the schools? When do we get to work with youth? When do we get to resume our activities? And then you wanted to know what others are doing.
Information that we got today, the presentations were really informative, but I was thinking if someone else can share in the chat maybe, so we don't get the meeting like too long. What type of strategies they have been using to reach the community or youth that are not social media and Zoom?
That's a great question. So put in the chat what you are doing to reach out to youth that are not social media and not on Zoom.
Yeah.
That's a
Thank you.
great question. Thank you. Yeah, please, we need the collective wisdom of the group to share that. That is a really important question. I see phone banking, so making calls. Okay. Telephone and text messaging, sending out postcards and newsletters. I have heard that from folks. Direct email to youth volunteers. That's great. Youth coalition, so connecting through your coalition, connecting through school email. Excellent. So for the next 8 minutes or so before we wrap up, I wanna give you a chance to share about what came up for you in your small group chats, or what questions you have. I just want to give us time to synthesize a little bit of, you heard all the things that the task force group has done so far. You've heard from Lee about what's happening in the office. You've heard from Laura about all the issues with vaping and COVID, and now you've talked to each other. So I would love if anyone wants to unmute and share a connection point that you had with someone else or a question that you have. Feel free to do that in the next, I don't know, 10 minutes or so. Anyone want to jump in? Oh, if you are talking, you might be muted, so double check you're not muted.
How about now?
Yep, I got your mic, yep.
Okay, so as we were talking in our small group, and I was also thinking about this before the meeting today, what can we do? Okay, schools are going to start opening and kids are going to start coming back slowly. Is there a way to do outreach to those kids on COVID-19 related issues along with vaping? Because the two things seem to be both kind of risk reduction. So the disease is being driven by younger people now. I mean, it's spreading through the younger population. Are we going to be able to do something in terms of giving those kids good information about the spread of COVID, along with maybe vaping anti-vaping information? I didn't hear the first part of the meeting, so maybe I missed something.
No, that's a great question. Any other thoughts on that? Or Lee, if you want to jump in, or Laura, or anyone else that was talking about that topic, feel free to chime in.
So I think that I'm always going to go back to we have an opportunity to provide a message to families, which is both adults and to young people, to meet them where they're at and really think through what being healthy looks like in general, right? And so I think about modifiable health risk factors and preventing chronic conditions for folks, for people, which incorporates modifiable health risk factors, which would be tobacco use, physical activity, nutrition, and stress reduction. And so being able to tie what wellness looks like and tie that into COVID and other virus-related challenges that we may be experiencing in general, I think will be incredibly significant moving forward. And I think about where organizations are right now, and this, unfortunately, I think a lot of folks are struggling to figure out how to move forward and what the new norm will look like because of COVID. And so that is a priority for a lot of people. The associated health risks and challenges that we're seeing may not be at this point in time, but being able to package it to meet folks where they're at, to continue to support one another and have that continuous engagement focused on wellness and actually hearing it from young people, which I feel like we need to hear it more from young people. That will be really important. I think definitely, Mike, tying it into the response for COVID will be incredibly important moving forward.
Okay.
That's great, Mike. Questions, comments, anything that came up in your session that you want to share, please jump in.
Evan, do you want to go ahead and talk a little bit?
Sure can. Hi everyone, Heaven here with LPKNC. I was in the group with Dustin and Danielle from AZYP, and I shared with what LPKNC had been doing with one of our schools in our SUSD district, which is a pilot program. It's something that we should all work on and do throughout all districts. The pilot program was when youth were caught with vaping products, marijuana products in the freshman class, rather than being suspended for X amount of days, let's say, give an example of 10 days, they were reduced to their suspension days because they joined us for a workshop. And with this workshop, we had their parents join us as well. And we just opened the conversation to let them know that it's their choice, spoke about the dangers of it and how it could negatively affect them in their future. And Dustin also shared that we should start asking for some data and getting the mandates going throughout all districts. Any other questions, thoughts? Is that good?
Yeah, I think that's excellent. I think one thing that was interesting was Danielle, you had a little different look at a different type of focus group, right?
Yeah, so right now we do just a general youth substance diversion course that they're referred through all sources. And then we tried to pilot it at Pueblo High School before COVID hit. And the disconnect we were having between the school and our program is that we're an outside source coming into the school, and the school wanted to do the same similar thing with not having their kids out for like 10 days and reducing it to like 3 if they did our program. But they weren't mandating the kids do the program. So it was kind of like if they wanted to do it, they could do it, but they weren't required to do it. So we had like 60 referrals when we first started, and then we had like 4 kids show up. So I don't know. I know it'd have to be done at like a school level to kind of figure out how that would work. But I think that's a huge disconnect with having programs like this going into schools.
Yeah, because I just want to remind everyone, before vaping had really hit, tobacco was yucky. It wasn't that cool anymore. And like high school kids were like, if you were smoking, they were like, that's weird. Like, what are you doing? And then when vaping came, it became cool. But what didn't change was school district policies and procedures. And so when you're caught with that stuff on campus, some days were automatic suspension longer than 10 days. And there were so many kids, talking literally thousands, getting in trouble, that if you were going to suspend all the students that got in trouble with vaping products, you'd have like half of your school gone. And so that was a big dilemma for schools. And I just think it was really interesting to listen to Heaven and Danielle's 2 examples of one that wasn't mandatory, as she told you the data, those referrals are really low. Whereas Heaven's, with the parents even involved, that's really incredible, because that's what we were really trying to go for in this next go around before COVID, was looking at the amount of these referrals and the incredible amount of time that is taking away from instruction. And that's just the second bad thing. I mean, we all know what this does to the body and to the mind and the families and kids and what it can do, which is the first priority. But the second priority is the adults, I don't think, understand how many hours a day these principals, assistant principals, teachers, kids were just involved with, which is all instructional time at the end of the day.
Yeah, that's why we wanted that data, so we could attach it to hours. Thousands of hours are being lost, so that the community would mobilize and be activated to want to respond as well. Any other questions and comments in a couple of minutes that we have left? We would love to hear from you.
Want to talk about what you're doing in Pinal? I just called you out, Darian. I'm sorry.
No worries. And I'm sorry, I missed that. What'd you call me out on exactly?
Wanted to know if you could share a little bit about kind of what you're doing in there in Pinal, and the kind of what you think would be thought through resources to support the work that you're doing, and maybe a little bit about some of the challenges. One of the main challenges that you experience is that definite age difference. I can't explain it the way you did so eloquently.
It's okay. So I represent the Copper Corridor Substance Abuse Coalition, and we serve Pinal County, which is superior to Oracle. And these are all rural communities. And a big problem for us is we don't have vape shops or smoke shops. The issues really are intergenerational, where you have grandparents, parents that smoke marijuana, THC, and they really, unfortunately, have a stigma about it, where we have a bakery in town that will put both marijuana and THC into their baked goods, and the community thinks it's okay. So, because of the stigma in these rural communities, it's really hard to get a hold of the youth and then to educate on the harm and consequences of substance use. And then, of course, as was brought up when we work with the schools, we have similar issues. So what we were trying to do is work with law enforcement, because right now the superintendent for the chief of police in Superior asked his chief to now have a law enforcement-led program in the schools. So we're trying to take that approach in order to reach the youth that way, because so far through the adults, we haven't been successful. So we're hoping to get our Mind Matters program, which is really trauma informed, and Too Good for Drugs into the schools to reach the youth. We'll also be working with Pinal County Juvenile Probation to get a teen court or peer jury diversion program. We'll be trained on it soon. And that way it's peer led, because the youth tend to listen to the youth, as was brought up, instead of the adults trying to reach out to the youth.
That's excellent. Thank you for sharing. And Darren, I think you should talk to Kate, who's on this call from Teen Court in Pima County. I am putting into the chat as we get ready to leave an evaluation. We would love your feedback. I'm saying that you will be investing in your own program feedback karma. We all run programs. We all want people to fill out our surveys. So if you could fill out our survey, that would be great. I put it in the chat. I'll send it out in an email as well. And as I mentioned, we will send out the slides from Laura, any resource information that was shared in the chat. Royce just shared some stuff. We'll put that in there as well. And we want to just say thank you. And this is just the beginning. We want to keep connecting. We want to keep chatting. We want to keep bringing you all together. Please reach out to us as a resource for anything that you need. I can field those requests. I can get them to Lee. I can get them to Laura. Any way that we can help, we want to help you. And if there is interest in doing more of these chats with all of you, we are totally open and interested in facilitating those gatherings as well. So we'll be reaching out to you. Please fill out this survey, but in an email, we will reach out with more and ask what else do you want from us. So thank you all so much for being a part of this issue. We really, really appreciate you. Lee, do you want to send us off?
I want to say thank you, and definitely sending positive thoughts to all of you, and I hope that you stay safe, be well, and support one another. And I'm really looking forward to continuing to work with you as we navigate life and how to support each other, especially young people that need it right now. So thank you for all you do. It takes that community to make a difference, that's for sure.
And thank you, Superintendent Williams, for joining us.
Thank you, Superintendent Williams.
Thank you, everyone. Take good care. Be safe.
Okay, goodbye.
Okay, bye-bye.
Bye.